I take a really great pleasure in seeing how some of our patients literally transform their lives on the hormones. Now, we will make exceptions. I have a lady, for example, who we've been treating, and she is going to Italy for 7 months. Well, practically speaking, I couldn't put her on the pellets because she would need pellets again in 3 months. So yeah, we put her on some transdermal creams. I have one lady that we give her testosterone, and she isn't getting. She still has a little bit of her hot flashes. So we might give her a little bit of estrogen in another form. You know? But generally speaking, and there are women in this audience, so we won't embarrass them or ask them. There are a lot of women in this audience who just say that this is a fabulous thing for them. So that's what we do. If you want to prevent aging, you can't prevent aging, but how you age is what you can alter. You're going to age, and all I can say is with all the things we do, what we do is bring the body back to another level. If people say to me, well, how long will this filler last? You know, well, how long, if we do what we call lipopulse, it's a term I coined, using this Accuderm machine. And they say, well, how long will this last? And I say, I can only bring the body back to a point. I give you a new start. I don't care whether you do liposuction or any of the other more, newer types of smart lipos and so on. If you lose all this, then you go out and eat 5,000 calories a day, you're going to gain weight back. Same thing with the hormones. We'd love to see the results that we get when postmenopausal or premenopausal women get their hormones and feel so good. If they stop them, they're going to start feeling lousy again. So how long do I take these hormones, doctor? As long as you want to feel good. How long do I get facials? As long as you want your skin to look good. How long should I take supplements? As long as you want to feel good. Now, in the back of the room, we have a representative from Pharmadex who has some equipment back there that measures your antioxidant levels. I can tell you this works. I can tell you anecdotally from my own experience and from the experience of patients. They can test your antioxidant levels, and there are a variety of different nutraceuticals, we call them, that you can take that will raise your antioxidant levels up to high levels. There are new things coming out in that area also that are skin-oriented or that are ingesting-oriented that are really going to do things like change your chromosomes for the better, obviously. So I would encourage you to, if you'd like, stop it, and Gigi there will explain the system to you and so on. And as far as those of you who've been here tonight, which we greatly appreciate, anyone who's come, if you'd like to come to our office and get a free Accuderm anti-aging facial, we'd be happy to do it for you at no cost. It is a totally, completely painless treatment. I did one on a lady in this room here the other day, and she came back today for another treatment, and the comment was, my skin is so smooth now, and we only did one treatment on it. So it works, and it's fun, and you should enjoy it. Can I answer any questions for anybody? Yes?
You were talking about the bioidentical. I'm going to be 63 in a couple of months. About 8 months, got on the pellets. And I have to say, I mean, it was like night and day. I mean, that foggy thinking, the achiness I was feeling, not having the energy that I wanted, and also not having the libido I wanted. I just got married after being single for 35 years, and it was, it was night and day. I was amazed at how I felt, the clarity. And it took a couple weeks, but I mean, it was just like this. Now the question is, I went a little bit longer maybe perhaps because you do the blood work, and maybe I'd gone like 6 or 7 months without not getting any of the injections, and then I can feel like what they call like a crash. Yeah, like I feel like, oh, I mean, I'm back to my old self again.
Yeah, I'm glad you brought that up. When we first started out doing this, we would obviously do blood work to start out with, then we would give pellets, and we'd say to the patients, well, come back in 4 or 5 months or when you feel you're starting to crash. We don't do that anymore. We put the pellets in every 3 months. Every 3 months. Yesterday, a lady came in. She had the pellets done 3 months ago. She said, I feel fantastic. I said, well, the last time you were in, you told me you were crabby, you were crying, you were irritable. She said, yes, but you realize the last time I told you I was too busy to come in. I had to come in for 6 months. Remember that lady yesterday? I mean, I knew all this, but I wanted her to say it. So I think it's extremely important that you stay on your schedule. Just that. Don't wait till you crash. Just stay there. We can't give you too much testosterone. Now, when we talk about life choices, I'm just going to clear up a couple things here. Women, they need testosterone. They don't need estrogen because the testosterone is going to supply the estrogen they need. So they need estrogen, but you don't need for me to give it to you. When I give you testosterone, you're going to get all the estrogen you need, okay? Now, there's a little choice. Some women come in and say, you know, doc, I've grown a few hairs on my face.
Oh, yeah.
So I said to them, would you rather be miserable, cranky, without libido, you know, almost divorced, or have a few hairs on your face? Well, that's the choice in life that you have to take.
That's what hair is for.
Yeah. It's a life choice, you know. Now, on the other hand, I have to say this. There are people doing what I'm doing who don't know what they're doing. I was called, Janet, you don't know this. I got home today and had a call from someone in Miami that is starting a clinic like this. And they hired a doctor who just wouldn't show up. So they asked me if I was interested in coming down to them. Well, I'm not. It's in South Miami, and I got my hands full, as is up here. And I asked them, what do they do? They said, well, we give testosterone and estrogen to every single woman who comes in. They said, do you give it to women who have a uterus? She said, yes. I said, well, you know that if I give you an estrogen pellet, you'll probably develop vaginal bleeding or uterine bleeding if I give you estrogen. She goes, oh my God, I've been bleeding for 6 months and I haven't figured it out. I swear to God, it's a true story. This was a lay owner of a, quote, medical clinic. No one told her she's been bleeding for 6 months. Now, it's physiologic bleeding, and it's probably nothing that'll harm her, but it sure causes anxiety. And you know what? She's going to her GYN now to have an endometrial biopsy and an ultrasound because, you know, we know what it is, but if that was my patient, I would say go, you know, because I don't want to take any chances.
But this is, in the whole arena for us women, this is bad because that's why it's just not so clear. It's not so, you go to one physician, he practices one way, you go to another. I mean, ladies, we need to really listen and not take for granted that they know everything. And here's the other thing, we're, us baby boomers, we're millions and millions strong. We are smart, we are economically secure, we are demanding. So now all of a sudden our physicians, we're going to them and going, doc, you know, the 7 dwarfs, itchy, bitchy, mopey, dopey, sleepy, forgetful. Well, he says, you know what, Janet? You're a little bored. Here's a little Prozac. This might help your hot flash. I am not bored. I am not depressed.
Help
me.
We've had a lot of patients who've been on antidepressants who, after they get on hormones, don't need antidepressants anymore. And in the psychiatric literature, they've done a study that shows about 1/3 of patients, female patients, who go to psychiatrists for help need to have their thyroids adjusted. That's their problem, thyroid. And I didn't say anything about thyroid. We look at the thyroid all the time. You know, it's an extremely important hormone, more so in women than men. You know, I left out the men. I'll give a woman, for example, 150 milligrams of testosterone. I'll give a man 2,000 milligrams of testosterone. And I tell you what, it makes them feel great. It really, really turns their lives around. There are other things you can do. You can do growth hormone and so on. That's a story for another day. It works. It's expensive. It involves daily injections. But there are a lot of things we can do.
The point to my statement is that there are many physicians and facilities opening up that are going into this hormone arena because they think that there's money in it. And yeah, guys, there is money in it, but it's so much more than that. We didn't start off in the hormone profession. We segued out into it as Brenda and I had the need. And so that's how it happens. This man has been doing it for 10 years. He didn't just wake up and say, okay, let's do it. So, you know, we have these other facilities that are opening up left and right that are just like little franchises. They don't have the right to be in that business. So we really, really, really thank you. We really need to pay attention and listen.
This is a product of my work. It's my wife. So she was my first Botox patient.
After the orange.
After the orange, right. My first filler patient, and I think you can see the results. Thank you all for coming.
Thanks,